I'm Madeline. First, I'm going to be giving a demonstration on how to give a IV piggyback medication. So first I'm looking at the completeness with the physician's orders in the MAR for Dore Dabney. And they're complete. And notice she's allergic to morphine. And everything's the same. So I've done that. And then I'm going to be doing some research, and I see that she has an increasingly warm red arm and she's been admitted with cellulitis. So the medication she's getting is Ampicillin, that's for her cellulitis. So first I'm going to wash my hands and get my medication. So for Dore Dabney, Ampicillin, 1 gram. There's 1,000 milligrams in here, so that's enough to begin the IV, and it says here IV use every 4 hours, and the time right now is 5:45, and it's due at 6 o'clock, so I can give this medication right now. I'm going to now look at the monograph. So for Ampicillin, it's an antibiotic, can be given by a student nurse. The usual dose is 1 to 2 grams IV every 4 to 6 hours, and I'm within the safe dose range. Reconstituted 1 gram with 3.4 ml sterile water. Can be given with 50 ml normal saline intermittent. That's what I have here, over 10 to 15 minutes. Look at the compatibility. It's compatible with normal saline, which is running right now, and I look at the potential hazards and additional notes. That's done. I'm going to take my medication and my sterile water, which I'm drawing up 3.4 mils. So I swab for 30 seconds and let it dry for 15. Swab for 30 seconds and let it dry for 15. And I'm going to wing this back. And wing this back. And attach it here. And still water, I'm drawing up 3.4 mils. So I drop 3.4 mils of air first. Inject into here. I'm going to drop a little extra just because I got some air in there. And I'm over the med waste, getting out that air.
So I verified I have the right patient, so I'm going to go ahead and just look at my primary line.
I have 3.4 mils of sterile water. And then I'm injecting into my medication vial.
So that's all good. I'm now just going to do my 30 shots at the bedside and put sterile on the syringe. I verified this is the on the wristband.
And I'm just going to reconstitute this by gently rolling it around. And now I'm drawing up 4 mils of medication because I have 250 milligram per mil as my concentration right now. So I swab this again for 30 seconds, let it dry for 15. I'm pulling back 4 mils. I inject that into my medication, and then I'm pulling back 4 mils into my vial. Getting out any air bubbles. Over the med waste. And then here I would have 4 mils.
Oh, sorry, that's not my tubing. I'll be labeling my tubing when it's up.
So now I've got my medication, my bar, I've got my 50 ml normal saline that I'm going to administer over 15 minutes, and my label. I'm going to do my second check. So for Doridabney, Ampicillin, Ampicillin, and that's what's in here. 1 gram, so 1,000 milligrams. There's 250 milligrams per mil after reconstituting, so that's 4 mils, and there's 4 mils in here. And I'm giving it IV via mini bag, 50 ml normal saline for a total volume of 54 mils. And every 4 hours, the time right now is 5:45, it's due at 6 o'clock, so I'll be giving this medication now. And I wrote down here 5:45. So now I'm going to take a swab. Clean the port for 30 seconds, let it dry for 15. And I'm injecting my medication into here.
Okay, so I've now successfully got getting the medication
That gets it started into the med waste. Gently rolling this around to mix it. And then putting on my label. I'm ready to go to the bedside now. I've got my MAR and drug card and medication. Got my secondary tubing that I labeled with the date and time and my initials. And an alcohol swab. And my calculation. So I'm coming in, washing my hands. Hi, I'm Madeline Hebert. I'm going to be your student nurse today. Can I see your wristband, please? Can you tell me your first and last name, please? Doridabney, checking against the MAR, Doridabney. And your birthday? October 13, 1996, October 3rd, 1996, October 3rd, 1996. Do you have any allergies? More things? Okay, that's what I have here too. And as I'm looking here, I'm also looking at the IV site, looking for signs of infiltration or extravasation. And that's patent, and it is. And I'm looking at the primary line to make sure it's not expired, the tubing or the bag, and that it's running at the right rate. Can I give you your antibiotic? Good, thanks. So I'm giving you an antibiotic called Ampicillin, and it's to treat your cellulitis of your arm. It works by inhibiting the cell wall synthesis of the bacteria. If you experience a rash or nausea, vomiting, those are side effects of the medication that happen, just let us know. And it's good to maintain a good fluid intake, so 6 to 8 glasses a day on this medication. And diarrhea might occur, and let us know if that happens. And as I give this, I'll monitor vital signs, especially temperature. I'll be looking at the blood work and the results of the CNS. Now I have to do my third check. So for Doridabney, Ampicillin, 1 gram, I wrote 1,000 milligrams, which was 4 mils of the medication. Put into 50 ml normal saline is 54 mils. IV, it's an IV piggyback, and every 4 hours. And it's 5:45 right now, which I wrote on here. And it's due at 6 o'clock, so it's to be given now. So I can now attach my tubing. So to make sure I maintain sterile technique. Put that into there. And I'm going to make sure that my clamp is closed right now. And hang this up just for now. I'm going to take an alcohol swab. We'll swab this cord for 30 seconds, let it dry for 15.
And then I'll get the
Well, that's attached. Now I can back prime my medication. So I can lower this and open up this clamp.
I still need like half of 130.
See all the air come out.
It's clamped right now with the settings on the second ring, so I have to
Close that up. It's about half full. It's good. And then lower this one.
and after the callback button, so because I'm going to come back and do things from not the saline flush, so that the entire medication will be given to you. So that you can
Put that up there.
and I'll clamp this. So it's running at a rate of 15 minutes.
My clamp is closed, so I'm ready to set the rate on the secondary. So I'm going to hit stop primary. I'm going to hit secondary. And I'm going to program
The next nurse coming in knows
216
and
per hour. And the volume is 54
signs your blood pressure and temperature.
mils.
Site and your
And that's good. So I go confirm secondary. And I'm going to open up my clamp here and hit start. I hit start, so I was doing an exit safety check after I make sure that there's a few drops coming on here. So can I count 3 drops? 1, 2, 3. Good. And this is all open here. And it's infusing. Clamps are open. Okay, there. I'm going to be back in 15 minutes when your infusion is done, and program a 15 ml flush to make sure that all the medication is out of the line, 15 ml normal saline. And I'm going to be monitoring for resolution of the infection. You're in a comfortable position. Just use your call bell if you need anything. And then I'm going to sign here the time, 0545, and my initials and my designation.